Hi, Dr. Bow here. I'd like to go over some basics about the spine as I've done some reels on like not cracking your neck and cracking your back, and I'd like to explain why about the anatomy and what structures are inside the spine. And this is the way a patient lays on the table. You can see they're laying here like face down. So this is the way the spine is on a patient laying here. So I'm picking this patient up and I'm putting him in my lap. Now here's the way the spine looks. It's got a forward lordotic curve in the top. And here's the skull. They give you, it's just the back of the skull here. And then the torso makes a little hump like that. And then the low back makes a forward curve like that. So we have two lordotic curvatures and one kyphotic curvature in the thoracic region or the rib area here. So let's start at the top. And you can see the top is the skull, and it meets up with the atlas vertebrae right here at the top. And the brain sits right in this culvarium, whatever they call it, up here. And then it comes down, the white matter in the brain, I'll show you later maybe on anatomy books too, the white matter is on the outside of the brain, and that's because all those gyrations, you see in the brain, that's to give the brain more surface area. I think it's supposed to be the size of a football field if you laid it out all flat. So basically all that surface area is used for the gray matter in the skull. So the gray matter is on the outside of the brain, and the white matter is sort of in the inside of the brain. And then in the spine, down here, by starting with the brainstem, it starts the white matters on the outside and the gray matters on the inside. It looks like a little butterfly. So the gray matters on the outside in the brain, and it's on the inside in the spinal cord. Where did it switch places? Well, that happened in this thing called the medulla oblongata, which is right here at the bottom of the brain. And B.J. Palmer, that's what he spent a lot of his life going around the world trying to figure out how far the medulla oblongata poked into the movable part of the spine. And that's what he did. He discovered that the medulla did poke into the atlas and the top of the axis vertebrae. And now we have MRIs and so forth, and we can look at that, excuse me, with those scans. But back in the 20s and 30s, he had to travel the world and trying to do dissections on different areas where he could do dissections. They didn't allow him to do maybe in the States. So he found out that the medulla does go down, and also what's happening is the sides are switching, right? Your right hand it goes from the left side of your brain, and the right side of your brain goes to the left side of the body. So somewhere that switching occurs, and it occurs up here in the brainstem again, right about here, and it's called the crus cerebri, and that's like that's what the cross of the brain. So it crosses from right to left, and it's involuting. The gray matter on the outside of the brain goes to the center. So it's doing those two things, crossing sides and involuting, all in this one little section right here in the medulla oblongata. That makes that medulla very especially subject to misalignment pressures, doing bad stuff to those nerves in that medulla. And that's why the last 20 years of B.J. Palmer's life, he said, no, I'm only gonna, just from here up in the school, is only gonna teach these top three vertebrae. He calls this C0, and the atlas is C1, and the axis is C2. So basically you weren't really taught or allowed, so to speak, to adjust the vertebrae below C2 in the school and during the 50s, so to speak. And then the third generation came along in the 60s, 64 or so, and I'm sorry I don't have the dates all correct, we'll look it up in history. And that he switched it back to full spine, and the schools taught how to work the full spine. But for a while there, B.J. Palmer only allowed the students to teach, they became experts at the upper cervical vertebrae and had to do adjustments using their hand. This is called the pisiform bone here. And that pisiform bone, I taught you that it had to make that funny move there. You had to be able to move your wrist like that to put a torque spin into that bone, because when that atlas is out of shape in this direction, tilting up and down, you had to be able to do that. So you had to be able to do this way, the spin A to P, and you had to be able to do the torque, and you had to be able to do the side lateral right to left, all in one thrust. And you see B.J. Palmer doing that on that knee chest table, and that's what he's doing. He's doing all three directions in one swift move. But the main thing I wanted to teach today was that the medulla does go down here, and it's especially susceptible to pressures because of the crus cerebri and the involution of the gray matter on the outside and the gray matters on the inside in the spinal cord.